So the most common complaints patients have who have done implants elsewhere is not about pain. It's about the surprise charges at the end of the treatment. Charge which is quoted to the patients, they have to pay around 30 to 40% extra at the end of the treatment. But is that the case at FMS? Today we have with us Dr.Shailaja Reddy, who is the Chief Implantologist and Director of FMS International Center. FMS is ranked number 1 in India and number 2 by the global clinical rating in the world. Ma'am had started placing All-on-4 implants in 2008. She had done her training in Malo Clinic in Lisbon, Portugal, where actually this technique was invented. So today we are going to have a discussion, an overview actually about cost of All-on-4 implants at FMS Dental. Ma'am, how come the cost varies in different clinics?
See, the most of the time, the cost, basic cost in FMS of All-on-4 for Noble and the Strawman is 4.5 lakhs. That is 4 implants with 2 angulated and the anterior implants. What includes in 4.5 lakhs? We have a CBCT included in the package, and we analyze the All-on-4, virtually place the implants and show it to the patient, as well as we include the prosthesis and guides. If you need a guide, we use a guide, whatever is needed for the basic All-on-4 with all acrylic prosthesis. Cost to 4.5 lakhs. That is for one arch, not for the full mouth. What makes it increases is very, very important. All-on-4 is a basic case, but not for all the population who comes to us. 99% of the population needs extra implants. Whenever we add an extra implant, then the cost goes high. Suppose the patient comes and he says, I want an upgrade. Then we add a zirconium bridge. Then the cost is 1.5 lakh added to the basic cost. Whenever there is a lesions, when you pull out the tooth, so extractions are needed and the lesions are there to curettage, that cost is added to the basic cost. And certain lesions are there, big lesion. When we put an implant, we need to do a bone grafting. If you need a little bit of bone grafting, even that is added to the basic cost. The size of an arch is not same for all the patients. Then we need an extra implant to take the bite forces. Or a patient is a bruxer. We need to increase the number of implants to take the load factor. And if the patient has a very soft bone, then we need to increase the number of implants. That is called as All-on-4 plus. That is for the long-term success we do. When we add an extra implant, the cost is added to the basic cost. If suppose the patient is very scared, if he wants an IV sedation, or we are doing in a general anesthesia, we need to admit, then the anesthetic charges and the theatre charges are added. That's how the cost increases from the basic charges, it goes high. But in FMS, this is all been explained to the patient. The tariff is written beforehand and given to the patient and taken a signature of them. Once they approve, then we start doing the case. After that, there are no hidden charges. The first day itself, we discuss everything. Surprises won't be there by end of it. We are given the stage 1 and stage 2 because they'll be having with a temporary for 6 months. The second phase is not increased once they come after 8 months or 6 months. It is all clear and there is no extra charges other than what we are committed to the patient. But somebody comes to your office with a tariff of 3 lakhs. Just please remember 5 points what I want to discuss. Just ask them whether CBCT is included in this package. The second one is what implants doctor is doing, the number of implants along with that, what company implants are used, and how the prosthesis is given to the patient. And next question is how experienced the doctor is. Because I see in my clinic most of the people, after they put the implant, they come and say, "Doctor, I'm not happy. Can you change the prosthesis?" No. The prosthesis cannot be changed after the implant placement. The implants determines the aesthetics and the function. We balance the occlusion with a TEC scan. When we do that, that cost is also added to the basic cost. The patient should understand when he is comparing the cost, what he is getting into. All-on-4 success depends upon and how well the occlusal balance is done to the patient for the success of it.
Ma'am, as you had said that from different countries also patients come. So what is the mode of payment at FMS?
Payment is through different modes, by credit card, debit card, or wire transfer or online transfer. In all the ways they're accepted, not the checks. EMI facilities for the Indians, not for the international patients.
So ma'am, why do you think people should choose FMS for doing implants?
You have to see the experience of the doctor, then the cost transparency, what happens in FMS, and the quality, what we promised, did we deliver or not, then aesthetically whether we achieved whatever we wanted, because All-on-4 is nothing but to improve the quality of life of a patient. Instead of denture, giving a fixed option so that the quality life of a patient is better. So that's the reason we ask you to go for an All-on-4 with an experienced doctor. Whoever the doctor it may be, you choose whether they promise you what they're going to deliver. That is very, very important. One more thing is we have in-house lab. When you have an in-house lab, the work is done faster and the aesthetics can be achieved better, because we have a chairside technician available. So whatever the way the patient wants, we can construct their prosthesis. That's the reason I advise FMS as the implant center for All-on-4.